Welcome to Bridging Healthcare with Bridget. Kindly subscribe, like, and follow this channel. Hit the bell so that anytime I make a post, you will be the first to know. Thank you.
Hello and compliments of the season. Welcome to another edition of Bridging Healthcare with Bridget. This is the Yuletide, and I just want to say Merry Christmas and a Happy New Year to everyone out there. And thank you for subscribing and liking my videos, sharing and learning from it. I hope it has helped you to be effective. Please just put in the comment section what you have enjoyed from all these videos. Just let's see how we're doing and how we can improve it. Thank you so much. And now let's dive right in. You all know that for this channel, basically is an educative and informative channel, and we focus on teaching health and social care in practical terms, how you can be a highly effective healthcare professional. How I teach you education, I teach you professionalism, I teach you manners, and I'm open to your ideas. And this is just my way of saying Merry Christmas. Anyways, let's go into the topic of the day. Today's topic is hot. In fact, I can't hold myself. I just feel like vomiting everything out, but let's start step by step. All right, today I want to discuss duty of care. Duty of care. For every healthcare professional, there's something called duty of care. You have a duty of care that you must obey no matter what the case is. You must obey. Now, by way of definition, what is duty of care? Duty of care is a legal obligation that is imposed on you as a healthcare personnel that requires you to adhere to a particular standard of practice when caring for a client, a sick patient, or whoever you are caring for. In other way, you can also say duty of care is an obligation. It's an obligation placed on healthcare professionals to act towards clients in a certain standard in accordance with quality control, with the rules to protect them and keep them safe. Safety is a big part of duty of care. So now that you already know what is the meaning of duty of care, you know that it's basically doing things, the standard of care that you must present to your clients that protects them. You know, I'm going to list out the principles of duty of care. So when I'm talking principle, I'm saying what duty of care entails. So if somebody says, what is your duty of care? You know that these are the things that should be found out in your service that protects the client, because the person you're seeing is vulnerable. The person you're seeing is not able to help themselves, and that is why you are there. So you have a duty of care, and you're a professional. Your work must be done with professionalism. So what are the principles of duty of care? Number one, choice. Now, every client has the right to make their choice. So if you're helping with personal care, let them probably choose out their clothes. If they cannot walk to the wardrobe, you can show them options. Would you like red? Would you like flowered? Just let it be they made their decision on what to wear. The same thing with food. Not because they take oat cereal every morning. What if the person doesn't want to have oat cereal this morning? So you can ask, what would you like to have? Would you like hot chocolate? Or would you like tea? Or would you like coffee? You see? So you're giving them options, and then they are able to make their choice. That way they feel included. They feel that their life is not run by them. Nobody wants their life to be, nobody wants somebody to just be running their life. Like you just tell them, okay, now you eat that. Let it be their choice. Number two is dignity. Everything has to be done with dignity. It's very important. Dignity is key. Remember when I did the video for person-centered care, dignity is also important. Dignity is taking into cognizance what the person represents and respecting that. So if somebody is a Muslim and you know that, for me, I'm a Christian, I don't cover my hair, but if I'm going to somebody's house that they prefer hair is covered, I cover it. It doesn't take anything from me. And then it brings for acceptance, So dignity is making them know that I see you, I know you are here, and I do exactly how you want to be done. The next thing is independence. Let people make their decision independently. Don't let it be, there's a way you can cajole people. You say, the person wants to wear a flowered dress, but you say this cloth is gray and I think you should wear it. Let them make their decision. Show them the options and let it be freedom of choice. Let it be what they want. And then the next thing is partnership. We work together. So if the person is a little bit mobile, you can engage the person. Okay, I want to make your toast. Okay, how do you want it? Would you apply the butter? Do you want it so two of you are doing it together. You're helping with personal care. Could you wipe your face, please? You see, that is partnership. We're working together. So that way the person also feels included and doesn't feel lost. The next thing is privacy. That you're giving somebody personal care does not mean some people don't want you to see their groin. So don't stay there. Excuse yourself. Oh, I've done your back. Do you want me to, can I excuse you? You see? Except the person doesn't mind. But if the person really minds, even before the person tells you, I don't mind, first excuse, except the person says, come back. Somebody is using the toilet or using the commode. Once you have helped the person to sit on the commode, excuse yourself. Once the person is done, they can call you. Even if the person is not able to speak, the person still give them, whether the person knows what you're doing or not, still it's duty of care. So you must do it. It's a principle. Next thing is rights. They have their rights. They have their rights to make decisions. They have the right to refuse medication. They have the right to refuse your services. You can go to a client and they say they don't want you in their house. Please leave. Call your supervisor. Tell them this is the situation. And if they say leave, you leave. People have rights. Somebody can be dying and say, I don't want my medication. Don't give it to them. Somebody can be, dying. They're supposed to eat, but they don't want the food. And you keep just encourage, and then the person says, no, I said I don't want. You know what? Leave and put it in your notes that the client declined. Declined medication. Declined. So it exonerates you, And then another thing is safety. And this is big in duty of care. So you're taking care of a client and the floor is wet. You must dry it before the person comes, because there's potential of fall right there. So because if that person falls due to that, it's your call. You are the cause of it. So duty of care says you'd wipe the floor. When you're cleaning their body, you clean them very dry. Do those little things. Let your eye be everywhere. That table, if this person is walking past, he will hit that table. Let me quickly shift it away. You see? That wire there are lots of hazards. So your eyes, your ears, your nose, everywhere you're looking around to make sure that there is no hazard that will make the person trip, fall, or whatever. You see? So that's why they have gates in some places. They put some barriers, they put, so that if somebody wants to sleep and that they can roll down and it's allowed for you to raise the hand railing, please do raise it. Put the bell at the lowest level. When you are operating the bed and the person put the bed at the lowest level so that even if they roll, they don't hit hard on the ground. You see? So those things are safety measures that you need to. You are using, you want to put somebody on the commode. It's a two-man procedure. One person should not do it. One person should not do it so that the person doesn't fall. The person wants to take tea. Check, is it hot? Let the person know that, it's red hot. Can you hold on for now? If the person's tea is too hot and they don't mind you dropping little cold water, drop little cold water in it. Those things are safety practices that you must put in place so that your duty of care is complete. Also, equality. Don't say, I'm going to see a black person if you're black, and say, because I'm going to see a colored skin person, I will do more. And then because I'm going to see a red person, I will do more. No. Treat everybody equally. Give your care. Be professional. Professionalism says the standard of care is the standard of care. So if I'm smiling to this person, I'm smiling to this person. If I will clean your back properly, I'll clean this person's back properly. I will not do this job shabbily and do this one better. No. So equality must be, it's a big principle in duty of care. Also, confidentiality. Confidentiality is very important. That you don't carry people's matter and start talking it up and down. So if you see on this channel, when I talk, I just give it as an open, like an example. Why? You can't just go and be telling, except you are reporting it. to your superior or your colleague needs to know, but that it is just a discussion. No, don't use it. I try not to even discuss my clients with my family. Like I'm home with my husband, I don't do it. How was work? Work was fantastic. Oh, I drove from here to here. Oh, that's it. I won't come and tell you, oh, this client, just try and, keep their matter confidential. So sometimes some clients will ask you, how is that client doing? Maybe they are friends. Oh, I don't know. You can ask him. It's not up to me, And sometimes, you're having a conversation with a client and, you just want to give an example. Make sure you don't mention anybody. Or do you know that person? You can give an example. It's a general example. But you are not talking about anybody. That is very important. Remember inclusion. Inclusion is also part of it. That the people are included in everything they are doing. Hi, John. Now I want to wash your back. Okay, now, John, I want to fold you. So they are included. So they know what is going on. Thank you very much. That is principle. Now, I want to talk about the standard that you should check. These are the things. You know what? I'll talk about that last. I want to talk about 3 main basic rules. I've talked about the principle, 3 basic rules. Number 1, what you're doing must be for their welfare, the welfare of the client. It must be, number 2, it must be for their well-being. Number 3, it must be in compliance with the care plan. Number 4, it must be done in good practice. So if you'd finished assisting somebody with personal care and you want to make food, of course you should change the gloves. Change your PPE in between tasks. It's not nice that you help somebody to wipe and then after wiping their below, that same glove, you use it to make tea, even if it is you. So there are some things that, it's not good practice. So don't do it. When I go to my clients, I don't take one glove. In my pocket, I have at least 5 pairs. I have 5 pairs and sometimes more. Once I'm done with this activity, I switch gloves. And I make sure that the clients see that I am changing gloves. It makes them feel more secure that, okay, this person is protecting me. Because the glove can, even though it's the client's body, you can introduce infection into the person. One of these days, I will talk about infection control for you as the care worker and for the clients. So it's very important to have good practice. Now, finally, before I go to the last part, which is the standard, how can you breach your care? It's possible that you can breach your care and it can land you in jail. Number 1, if a client has an injury due to your negligence. So you will see that negligence will be tagged as your offense. So you did not dry the floor, or you left the bowl there, or some people, when they use their bathroom, you have to mop it dry because anytime they go there, because the bathroom is still wet, they can fall. So you didn't mop it and it's in the care plan. You're going to be in trouble. You're going to be in trouble. So be careful. Number 1, that's number 1. If that thing is foreseeable, you could have averted it and you didn't. You didn't turn off the gas cooker and there was gas smell everywhere and the client collapsed. Neglect. You see? You are taking a call and you are not concentrating and hot water pours. You are taking a call, you're not concentrating and hot water pours on the client. It's neglect. You can also. So you are taking a call and hot water pours on a client. It's neglect. You can also get penalized for that. So it's very important to be careful. Now, before I wrap up this video, I want to tell you what are the standards. What are the questions you must answer when you are giving care? Number 1, what you're doing is the client safe? We're talking about the client. Is my client safe? This thing I'm about to do, will it make them safe? That's number 1. Number 2, is it effective for them? Is it going to help them? What we're about to do, is it going to help them? Is it effective? Number 3, this situation, this activity that I want to do now, is my client carried along? Am I carrying them along? Did I tell them this is what needs to be done? Did I explain the procedure to them? And lastly, are they responsive? So you want to apply cream and you're applying it and the person is not responsive. You're asking, Are you okay with it? But maybe the person wants more. You see? Maybe you're not touching the right place. Maybe the person wants you to help them scratch their back. You're washing their hair, you're doing hair care, and then the person wants you to wash it hard. Some people want you to wash it hard, and some people want you to go easy. So you need to carry them along to ask, is this how do you want it? That way you're carrying them along. I hope this video has been able to break what duty of care is to you. Guys, duty of care is big in health and social care. And if you want to be professional at your work, if you want to be highly effective, then you really need to understand duty of care. Please watch this video over and over again and tell me what you think. It makes you highly effective. Thank you so much for always being there, for liking, subscribing. Thank you, and thank you to all my subscribers. And please share it to your friends. Let's grow the house. Thank you for coming in. Thank you for always watching. Drop a comment. Talk to me. Let me know if there's something you want me to talk about. And of course, I will go and dig in and I will bring you solid information. This is Bridging Healthcare from Bridget. Bridget is your host. And I hope that you keep getting better at your job. Thank you so much. And don't forget to subscribe, like, and share. I always say that, right? All right. Thank you. Bye.